Gadai from Healthcare Israel. Describe the system the way you have it in Israel. I mean, about coverage, about how you organize it, etc.
Okay, so the Israeli health system is based on a health insurance law enacted in 1995, and we have basically three areas of the health system. One is the regulation by the Ministry of Health. One is the insuring health insurance by the HMOs. These are basically non-profit public health insurers.
Yeah, four of them, huh?
Four of them in Israel. Yeah. The largest one, Clalit, Maccabi, Meuchedet, and Leumit. And we have a vast number of providers. Hospitals are government-owned, some HMO-owned, some non-for-profit, and also independent providers, clinics, and also independent doctors serving the population.
Universal healthcare, the GPs are very important. It's like a copy of the Netherlands. It's really canny. Now, but on the other hand, the whole digital layer underneath it, you have already records for 25 years. I mean, when was that enacted?
First of all, I think if I understand the basic difference between the Israeli system and the Dutch system is that in Israel the GPs are part of the HMOs, and most of them are hired by the HMOs, paid by the HMOs, and they used to work for the HMOs. The digitalized system in Israel dates back to the early 1990s. That is the health insurance law, and the large HMOs, once they had to provide the services by law and monitor the services, they had the incentives to invest in digitalization, in medical records, and that is the reason that we have only 4 HMOs. It helps providing the EMRs for the whole population very quickly. It started in the 1990s with the law and up until today.
Yeah. What are the biggest challenges for the healthcare system in Israel? Because you don't spend a lot of money as percentage of your GDP at the moment. Everybody seems unbelievable happy with an 89% happiness ratio. What are the big challenges?
Well, first big challenge is personnel, the coming shortage in doctors and nurses and in general health personnel.
Really?
Another challenge is the aging of the population and the wider services that will be needed for the aging population.
But that's the future, because you only have 12% at the moment. Elderly people above 65.
We have even, I think, less than 12%, around 10.7 or something like that. Yeah, it is a problem of the future, but we have to get ready for the future. And if you're talking about pressing issues right now, it's also the waiting times, especially after COVID-19, but also before that. Since it's a public system, public financed, low expenditure, then we have waiting times and waiting lists, and this is also a big issue on the Israeli agenda.
COVID-19, what did that do to the healthcare system?
Oh, it's a big question. I'm not sure you can answer it right now because we're not even at the end.
No, but I mean, what has it caused? Because I saw that telemedicine went up from 20% of the population to 33% of the population, so there was a big increase.
A lot more telemedicine, but I think also a lot more distrust between the population and the health system or the health professionals. Not everything that was said about COVID-19 happened, and I think it is also a big issue of distrust. But we have very high rates of usage of the health system, and telemedicine does not solve it by itself. So. It's early to say what are the impacts of COVID-19.
You were the first to basically put in vaccine. You were also the put in the second vaccine, and then the booster 1 and the booster 2. Is that also what you mean by distrust of the population, that they have to do booster after booster after booster?
No, I don't mean that by distrust. Distrust, I think, because what was said about COVID-19 by the health professionals and the Ministry of Health didn't really actually happen, and a lot of population, I think, all over the world are feeling maybe they were not being told the truth, and next time they meet their doctor.
What do you mean? They had too much fear, or
it was too much fear, lockdowns. And I think a lot of people feel that it was not needed. It is hard to say if it was needed or not. It is not very easy to say.
Yeah.
But if you talk about the health delivery system, I think the Israelis trust it, and we saw it with the vaccination. Because the reason we managed to do this large vaccination at a very short time is because the health delivery system is very strong in Israel. The logistics, the HMOs, they know every patient, they know every person enlisted in there, where they live, what are their services, who is their doctor, and they can reach them very quickly. So this is a very big strength of the Israeli health system, and this is why we managed with the vaccination of COVID-19 very good.
Yeah. If I go from one HMO to the other one, which I can do 4 times a year, it's amazing. Is it then really easy that all the patient information goes from one HMO to the other? Is it flawless? Is it painless? Is it automatic?
Yes, it is quite flawless and automatic. The HMOs turn the data
So
from
any provider of care can immediately access the records. Does the patient have to have permission, or can the health provider just type in the name and immediately get it?
If the the HMO provider can see it, can access it immediately. Independent providers or hospitals, it depends if they are connected to the health information exchange system. Once they are connected to the national system, they can see the data from the HMO in their own system. Most hospitals are connected to that. Not all of independent providers and clinics are connected.
No, but they have a way to access it. You basically distribute the budget based on gender, based on age, and based on geography. Is that a good formula? Is that formula going to be expanded? And because if you have an elder person, it's about 5 times as much as a younger person. Is that formula a big discussion every year?
It is a discussion every 3 years, but it's not a political discussion. Okay. It's always internally between the HMOs and the Ministry of Health. Yeah. I don't think it will change dramatically in the next years. I think the age grouping is very good, very important. It gives enough flexibility to the HMOs to manage their budget, but also it gives a good indication of the costs and the services needed for the populations. Yeah. Maybe the elderly population will receive a bigger chunk of the budget in the next years, but the parameters I don't think will change dramatically.
You worked for 10 years at the ministry, and now you work for a promotion center of digital healthcare and you still work in the ministry. Who is the boss in the healthcare system? Is it the HMOs, is it the ministry, or is it the big hospitals?
It's a good question. I think each one that you will ask, they say the other one is the boss. The Ministry of Health is the boss. On economic issues, it is also the Ministry of Finance, but the HMOs are very strong. Clalit and Maccabi are very strong. They hold 75 or 80% of the health system. So you cannot do any kind of reform or change in the Israeli health system without these organizations. Also, the large hospital managers, they are very strong. They are very strong politically. The doctors look up to them. So if you're a manager of Sheba Hospital or Ichilov Hospital, they also have a lot of strength in the system. The doctors union and the doctors are the boss, I think, if you can say in general, but they are divided between different organizations.
I see. It's a mixed bag. Doctors work during the day for the public system and during the evening in the private system, and they make more money that way. What percentage of the total cost is public and how much is private?
It's about 70% public and 30% private, and the private also includes the supplementary services given by the HMO. So it is semi-private, and that is a big chunk of the 30%, and the other big chunk of the 30% is private operations going on in private hospitals, like you said, in the afternoon and the evening, performed by those same doctors that work in the public system in the morning.
Okay, so it's semi. Hey, you have this promotion center in Israel, health care Israel. How much of these working together between the private and the public companies is resulting in successful companies which export their products?
I think a lot of it. Israel is now a very big world hub of health tech and digital health tech. And I think the reason is that they have access to the HMOs and the hospitals here, very high expertise, cheaper than in the US and close to home. And Israel is a startup nation and they have a very good health system. So if you put it together, you have also the health tech, the digital health nation.
Yeah. If the HMO use them as a client, if they're the first client, the launching customer, do they get shares from the company? Do they invest in it? Is there an ownership connection?
I think usually they have some kind of usage agreement that the HMO can use the application or the system inside and pay a little less or maybe not pay at all because it was a design partner of designing this application.
Okay. Thank you very much.
You're welcome.